Welcome to Kaleidoscope Toy and Miniature Australian Shepherds in Raleigh, North Carolina. Beautiful day. We got a reprieve from the heat today. And I just wanted to share today, I gave Bernie, you can come over? You can come over and see me? Maybe not. I gave him his 12-week booster shot, his DHPP booster shot. So he's got that in him now. And I just thought it was kind of interesting to get off that on the package, because here, in North Carolina, I think every state, I'm not sure, you can vaccinate your own dog. And I was a veterinary technician for many years, so I know how to vaccinate dogs. But a lot of people do vaccinate their own dogs. The only thing we can't do here in North Carolina is rabies. So I do believe in the puppy series of shots, 8, 12, and 16 weeks. But after that, it's kind of interesting. On this package, it says that the need for this booster has not been established. Okay. It says the presence of maternal antibody is known to interfere with the development of active immunity in dogs. That's why you give them an 8, 12, and 16-week shot. It's not that you're building immunity, it's that you're trying to get to where it'll be effective, because the mother's antibodies are overriding it. The presence of maternal antibody is known to interfere with the development of active immunity in dogs, and additional boosters will be required in most young animals. Here's where it gets interesting. Historically, annual revaccination with a single dose has been recommended for this product. That is for, your yearly vaccine. The need for this booster has never been established. For advice on revaccination frequency and annual booster vaccinations, consult with a veterinarian. Okay. So basically what they're saying is there is no science behind the annual vaccinations. And, they just do it. Once a year, your dog goes in, it gets a shot, and there's absolutely no proof that it's needed. So we don't do that. Our puppies get a puppy series, 8, 12, and 16 weeks. And then after that, we do what's called Titer testing. And about once every 3 years, get the dogs Titer tested. And I've never needed to give my dogs ever another shot. Ever. So I even had a dog that was 17 years old, and we did her titers right before she passed away, and she had her puppy shots, and she never had another shot for 17 years. Now, I'm not giving you advice. I'm just telling you to do your homework, pay attention, and, they used to think, because I worked in the veterinary field, I was a veterinary surgical technician, and they used to think there was no such thing as over-vaccination, and that it was no harm, no foul. They could jab the dog, stick the dog once a year. But now they're finding that certain cancers, behavioral problems, and other issues are arising that are caused by vaccinations and over-vaccinating animals. So personally, I like to be careful, and I don't just arbitrarily stick a needle in my dogs or have the vet do it just because they recommend it, because obviously on the package it says that need has never been established. So I prefer to get the Titer tests, and that tells me if I need revaccination. Now Bernie's over there with his mom. I don't know if you can see him, and I'm just keeping an eye on him. After vaccination, whether you do it or you take it to Tractor Supply or to a shot clinic or to the veterinarian, I don't like to just rush the puppy away from that venue. You want to stick around, whether it's in your car. That's why I like to go to Tractor Supply. If I'm doing, because rabies has to be done by a vet here by law in this state for whatever reason. So I'll take my dog, because I don't do my dogs before 6 months, to Tractor Supply, and I push him around and we shop, and then he gets his little shot, and then we stick around and we shop for about a half an hour, because if there's a big fat reaction to the shot, I want to be close to that veterinarian who has the epinephrine. I don't have epinephrine here, so I'm sitting with him. There's a vet close by. If he started showing any kind of a reaction to the vaccine, I would rush him over there. They could give him some epinephrine. So you don't want to just have the vaccine and then rush home from the vet and not be paying attention to your dog. But if you have one of Barkley's puppies, it's time right now for their 12-week vaccination. I just vaccinated Bernie, and I'll be revaccinating him at 16 weeks before he goes to his new home where he's going to be a therapy dog. And then they'll do what they do with him. But read the fine print. Just read the fine print. Of course, when you go to the vet, you're never going to see the fine print. But anyway, thanks for watching. Don't forget to like, subscribe, comment, and share.